Hi guys! So today I'm going to be doing a video on the importance of delegating in nursing. And I know when I got my first nursing job, I struggled with delegating at first, but was kind of amazed at how quickly I was able to adapt to delegating. Because I feel like as a student, you feel like you have to do everything. Even when you're in clinicals or lab, you feel like you need to do everything on your own. It's like in your head you're trying to prove to yourself or someone that you can do this and that you can do everything and that nothing's going to stop you. And I had that same mentality even in my simulations. An instructor pointed out, why do student nurses always feel like they have to do everything? They forget they can call their charge nurse, they forget they can delegate to their CNA. And I struggled with this at first, but I actually was kind of amazed at how quickly I was able to learn to delegate. I think the hardest thing for me to delegate is those like basic care necessity things for patients, like changing their briefs, helping them shower, helping them get cleaned up, helping feed themselves. And it was hard for me to delegate those things because those aren't necessarily the most fun things to do as a nurse. Hey, off. And so I felt bad delegating them to like the nursing assistants or CNAs on the floor because I thought, well, I feel bad giving them something that they may not want to do.
I'm not sure I understand.
Hey, stop it. Be calm. And so delegating is very, very important. And it's important to know your role as a nurse and the things that you are allowed to do and supposed to do. And know the roles of the CNAs and what they're allowed to and what their kind of job role is. And I don't mean that in a bad way, I mean that in a very good, positive way. Because as a nurse, there's going to be times where you have to go see other patients because they have critical medications due, or maybe they're having trouble breathing, or they need you need to do an assessment on them really quick because something odd is going on with them. But then you have a patient that needs their brief changed and has soiled the bed and needs their linens changed. Well, even though you can technically do both of those things, it's kind of hard to be in two places at once. So it's important to learn to delegate to your CNA, or maybe ask the charge nurse if they could step in, or another nurse if they're free. I have made a video before on loving and appreciating your CNAs, and I'm going to say it again. You gotta love and appreciate on the CNAs because seriously, they help out so much with those basic care necessary things for patients to have. And sometimes as nurses, we get so busy that we don't have necessarily the time to be in a room for 30 minutes changing up a patient, changing their linens, changing their brief, turning them, putting cream on their skin. And not saying that nurses shouldn't ever do that, that's not their role, because that is your role. You do those things as a nurse, and it's important that if you delegate to a CNA or you delegate to another nurse, that you ensure that whatever you delegated gets done. I've had times where I asked a CNA if they could do something and maybe they got super busy and forgot about it, and it's my role as the nurse to follow up and make sure that patient got what they needed, or they got the care that I delegated to whoever, because it is my role. Those are my patients. I need to make sure that they are getting what they need. One thing that I've learned, and I learned this also from my preceptor when I was precepting before I actually was on my own at my job, was to ask for help earlier on rather than later. So if you notice in the beginning of your shift that you are slowly starting to creep behind or quickly creeping behind, you have to ask for help. And I have really taken that to heart because I feel like when I get behind, I tend to kind of get a little overwhelmed or flustered, and I think that's with anyone that they sort of get that way. And so if there's someone that's just sitting down and maybe chatting or surfing the web or whatever, ask that person if they can help you, if they're allowed to help you with whatever you need, because really, nursing is all about helping each other. It's about teamwork. I can't tell you how many times stop. I'm messing my camera up. I know, you're so cute. I know, you're so cute. I can't tell you how many times a nurse has come up to me and will say like, hey, Ashley, can I do something for you? And I'll be like, oh, no, I think I'm okay. I just have this, this, and this. And they'll be like, no, let me do one of those things for you. I don't have anything going on. And I say, okay. And vice versa. I do that for other nurses as well. It's so important to, if you're free, go ask the other nurses if you can help them out, because chances are, even if they may not be super busy, you can help them with something that'll free up a little more of their time and give you something to do as well. Alright guys, thank you for watching this video. Leave me a comment in the comments below if you have delegated something and how it turned out or what you delegated. Just leave me some love in the comments. Give this video a big thumbs up and subscribe to my channel, and I will see you guys next time.